After an adjustment by Dr. Davis and half a dozen treatments, I guess it was a dozen treatments, I kind of went on my own. The cartilage in the knee has totally rebuilt, and my meniscus is at about 70%. I was biking up in Alaska this past winter, up in the foothills, and just no issues, no pain.
So how much are you biking? How would you say on an average day? How many miles do you go?
I probably do 15 to 20 on a shot. Well, and I went from 280 down to I'm probably 210 today.
Wow.
That in itself is a huge, just being able to get back in shape. With a bad knee, it's
right, because now you're able to be active and you're out there doing what you love to do, riding that bike across country everywhere.
Yeah, having a good time. You got your health and your body and your knees.
Absolutely.
You enjoy your life.
So what would you tell other people out there who are suffering from knee pain?
You've got to come and see Dr. Davis. There is no point in struggling with an achy knee or a bone on bone like I had, bone on bone.
Right.
And it's the got to.
Hi, I'm Dr. Robert Davis with Active Health Knee and Shoulder, and I'm here today to explain to you how our non-surgical operation has helped hundreds of people that were previously suffering with chronic degenerative knee pain get back to those activities that enrich their lives. Many of the people that come to our clinic are looking for help and have been suffering with knee pain for quite some time. And they've tried the injections, they've taken the drugs, they've had the various therapies, all with little to no improvement. This leads their doctor to tell them that they have bone-on-bone degeneration and that their final and only option is to have their knee replaced. Well, I'm here to tell you that you do have another option. Our non-surgical operation is a neurological treatment system that resets the communication between your brain and your knee, instantly decreasing pain and inflammation, increasing strength and flexibility, increasing blood flow and tissue healing, and allowing you to get back to those activities that you were missing out on. You see, there are two important nerves that control the movement of your knee. One of them is the sciatic nerve, and the sciatic nerve branches off the lower part of your spine and it runs right into the back of the knee. It actually goes into a tiny little muscle called the popliteus muscle. And this is a muscle that attached to your femur bone and your tibia bone, and it unlocks the knee so that the bone's clear when it bends. The other nerve is your femoral nerve. Now your femoral nerve branches off basically the same area here, and it runs into your quadricep muscles. Your quadricep muscle is what controls the extension of your legs. So when you reach out to take a step, or if you were to kick a soccer ball, that's that femoral nerve firing into those quadricep muscles. If there is a lesion along the pathway, now let me just explain this. The right knee is controlled by the left side of your brain, okay? The left side of your brain is going to control your right knee. So if there is a lesion along the pathway, what I mean by that is if there is some type of interference which is causing static in the lines, guess what happens? The knee stops unlocking before it bends, and the bones don't clear and they start shearing together. And this is what leads to that chronic degenerative knee pain that most people are suffering with. So what we do, what's different about what we do, is we get to the cause of the problem. We reset the communication so your brain talks to your knee and your knee can talk back to your brain, and the knee starts to unlock again. You can get back to all those things that you've been missing out on. So if you're suffering, if you have a loved one that is suffering with chronic degenerative knee pain, you've tried the drugs, you've taken the injections, you've listened to the doctor, done all the therapies, and you've got little to no results, then it's time to give us a call. On the screen here, we have a phone number. Give us a call today. Within 2 visits, we'll be able to tell you whether you're a good candidate for our non-surgical operation. We'll do a thorough neurological examination and a thorough report of findings. So give us a call today. I look forward to meeting you and I look forward to helping you. God bless.
Welcome to Active Health Knee and Shoulder.
Most of our patients are nearing retirement age or already in retirement. At your first visit, we want to get to know you and why you're here. What are your challenges and what are your goals? How is your knee pain negatively impacting your life? Is it affecting you going for walks with your spouse or kneeling down to play with your grandkids or pick up a golf ball? Is it affecting your sleep? Once we discover why you're here and what your goals are, then it's my job to determine whether or not you're a good candidate for our non-surgical operation. I'll perform a complete neurological examination to determine the role of your nervous system in your knee pain. And then I'll order any necessary x-rays. Your next step will be to schedule your report of findings at the front desk. At your report of findings, I will let you know whether or not you're a good candidate for a non-surgical operation. I'll give you my best recommendations to help you achieve the goals that you're looking for. I'll let you know what went wrong with your knee, and I'll help you understand why all the movements you've done in the past without a problem have now become so difficult. I'll explain how our non-surgical operation works and what it's actually doing to get the knee to unlock again. You'll also get an understanding of the assisted therapies in the office and how they help to reduce pain and inflammation and assist with tissue healing. This is a team effort. You will need to do some therapy at home as well for the best results, so I'll explain what that looks like. Next, I'll go over the details of your care plan, the costs, and take care of payment. Now you're ready for your procedure. We'll bring you through certain movements before we do the procedure, so we have something to compare with afterwards. We want to see a good improvement. We're not looking for you to run up and down the hallway afterwards, but we do want to see a significant improvement after we do this non-surgical operation. The NSO works similar to a tendon reflex. When I tap on your patella tendon below the knee, one little tap tells your brain to quickly strengthen your quadricep muscles, and your leg kicks out into extension. I take the knowledge of the nervous system layers deeper, and I get the knee to unlock properly by resetting the communication between your knee and your brain. Now you're ready for your non-surgical operation. We'll bring you through some movements before we do the procedure, just like you saw in the videos of patients who have had the procedure done. We'll have you transition from sitting to standing, have you do a squat, have you walk up and down the stairs. We want to see where you're at so that we can see a comparison after we do the procedure. The operation takes about 30 minutes. It doesn't involve any drugs, no surgery, and no injections. The NSO works similar to a tendon reflex. When I tap on your patella tendon below the knee, one little tap tells your brain to quickly strengthen your quadricep muscles, and your leg magically kicks into extension. I take the knowledge of the nervous system, I take it many layers deeper, and we spend about a half an hour retraining your knee and your brain to communicate correctly, so there's no static in the lines. This is what allows your knee to start unlocking properly, and that's why we see so many dramatic results after the first procedure. Many of our patients have been suffering with knee pain for months and sometimes years. For quite some time, they've had difficulty navigating stairs, transitioning from sitting to standing, squatting, or just going for a walk. Your knee joint has gotten sloppy and weak and has put an unwanted stress on the supporting ligaments and tendons. Once we determine the knee procedure was successful, you will be given a home routine to build back the strength and stability you had lost. We want your everyday activities to become easy again.
Functional neurologists work with neurological disorders without the use of drugs and surgery. Dr. Davis has been in practice for over 20 years. He is a board-certified chiropractic physician and graduated from Life University in Marietta, Georgia, where he received his doctorate degree in chiropractic and earned his bachelor's degree in nutrition. He knows the body inside and out, top to bottom. I'd like to give you a tour of our office. This area is our assisted therapies. Once Dr. Davis has performed his non-surgical operation, he will have you do some of these therapies to assist in the healing process. Many of our patients are told they have bone-on-bone degeneration and only given the option of a knee replacement surgery. The knee on track helps by opening up the spaces between the bones and facilitating the unlocking of the knee. The back on track is a spinal decompression table that opens up the spaces between your vertebrae, removing nerve pressure. This allows your brain and your knee to communicate without interference, improving function and stability. Once we have all the joint spaces open, we have you get on the pulsed electromagnetic frequency therapy, PEMF, which recharges the cells and increases blood flow. The total brain and body therapy forces the maximum amount of oxygen where it is needed most, the damaged and inflamed tissue, and allows them to return to a normal aerobic metabolism. Together, all of these therapies help in reduce pain and inflammation, increase blood flow, and assist in the healing process. I would like to point out that Dr. Davis is a certified functional neurologist, a certified trigenics practitioner, which you're going to learn a lot about today.
I'm Dr. Robert Davis with Active Health Knee and Shoulder. You may be asking why our clinic doesn't take insurance. The answer is simple, because we want to provide you the best opportunity for you to be living that active, pain-free life that you may have been told you couldn't live unless you took the injections, took the drugs, and eventually had the surgery. Most places only prescribe drugs designed to cover up your pain symptoms, but that doesn't really solve your problem. That's why at Active Health, we're different. We resolve your knee and neuropathy pain with natural methods, getting to the cause of your problem. Our therapies and procedures use technology that is so advanced that they haven't been accepted by insurance. But the benefit you will receive avoiding unnecessary drugs, surgery, injections is priceless. Is it worth working outside of your insurance? Yes, it is. But don't just take my word for it. Listen to our patients. Hi, it's Dr. Robert Davis with Active Health Knee and Shoulder, and I'm here with Rex, and Rex is one of our patients that came in for knee pain, chronic degenerative knee pain, and neuropathy as well.
Yes.
Doing treatment for neuropathy. So he came in with two conditions. And last week when he went down to, I think it was Key Largo,
Yes.
and he had a nice experience, and he had just started the treatment protocols in here. So I was just wanting him to kind of go over the symptoms that he was having before he came in, and then what the improvements he's noticed just in a couple of weeks that he's been in the office. So Rex, if you could just tell me what you told me last week, because I was excited.
My wife was excited. I could never walk with her any length to go on the beach with her or anything. But this time, we went down, we were walking, and we walked a quarter of a mile. I was amazed that I could walk that far, because I couldn't go 200 feet without being in pain.
Right.
And we walked it, came back, I felt good, and she was thrilled because she always loves to walk the beach, and I haven't been able to do it so far her to do it without me. But this time was really great, and it felt so good to be able to do that with her.
That's fantastic. So the problems that you were having before, what were some of the symptoms? Not that everything is fixed right now, I understand.
No, anybody has to understand that you just don't come in here. I've been going for years with this, and I went to 2 orthopedic surgeons that told me I had to have a hip operation, a knee operation. When I came here, it was a whole different story. And to me, it's great. My knees are feeling fantastic, okay? I couldn't even swing a golf club, it got so bad. Now I'm out hitting balls twice a week now. It's been fun. You know what? I'm an old man, but I'm having a lot more fun now.
That's great.
And I'm really happy with it. I'm really happy with the staff. And I'll tell you, anybody that doesn't come here is foolish. I'll tell you that. That's my opinion.
I'm so happy that you're doing better. And thank you for sharing with everybody. And it's only been, I think, 2 weeks now, maybe 3 weeks that you've been here. So I think things are going to improve and even
Absolutely.
more for you.
Absolutely. It just, you just feel it. It's,
Right.
I don't know how to explain it to you, but when you come here, you know it's going to be, you're going to get better. It's not going to happen overnight. And you got to make sure that you do the exercises. That's important. And I'll tell you something. I didn't exercise for nothing. I exercise now. I have a stationary bike. I ride every day for 40 minutes on that bike. Every day. That's the stuff that you have to do. I don't know. Tell anybody, but try it. Like it.
Thank you so much, Rex. I appreciate it.
On and off for a long, long time, but I fell.
Oh, I
8
see.
weeks ago, running up the steps, and really hit it hard,
Okay.
and it just won't bounce back anymore. Moving slow, any kind of activity, it's gone, and I'm limping, walking crooked, unsteady, gaining weight, which I know doesn't help for the pressure on the knee. Yeah, I can't live like this anymore.
Yeah, so you're here to get some relief so you can get back to those activities. I'm gonna have you just do a couple different maneuvers for me so we can see exactly where the pain is and where we're gonna start with your procedure. I can see it in your face already, yep.
Yeah,
And slowly come back up.
it hurts.
Now, I want you to point to where it was hurting.
All right in the front part of the knee.
Below the
This
kneecap.
This whole area here.
The whole kneecap, okay.
This whole area here.
Okay. All right, so I want you to go up and down the stairs for me. I want
'Cause
you to
don't
hold
wanna
on.
Take a chance of flopping over.
Okay.
Yeah, I'm like an old lady, like an old rickety.
Well, we're gonna get you young again. At least walking.
And before this, I mean, I'd run up these steps. I'd run up 4, 5 flights of steps with not even holding on to anything.
So your balance is affected too.
My balance is horribly affected. Like I'll be walking inside my unit, my condo, and I'll be knocking into the wall.
Right, because you just kind of lose your balance
just
and then you
kinda-
got to catch yourself.
Right. It's like, nothing's.
So going up and down the stairs, was it the same spot hurting?
Yeah.
Was it worse going down the
It's worse
stairs
going down.
or coming up? Okay, so down the stairs was worse. All right, you ready to get started?
I sure am.
Let's do it.
7 and release. Take a deep breath and press. 1, 2, 3, press. 4, 5.
All right, I'm gonna have you walk down the end of the hallway. Yep,
Okay.
and then come down the end of the hallway, turn around and come back. Here she comes.
She comes walking down the street.
Yeah. It is better.
I'm not looking for perfect, but you should
Oh
feel
my
much.
God.
Yeah.
What feels different, Celeste?
Oh, when I put my weight down walking, I don't collapse.
Oh, awesome.
So you feel like it's a little bit stronger?
Yeah.
It's not as weak as what it was before.
Right. I'm not weak, and it's not as painful when I put my body weight on the right side.
Good job.
Yay! Welcome aboard, Celeste. All right, Celeste has done her first non-surgical operation with Dr. Davis on that right knee. So Celeste, let's see what you can do. Can you stand up for me?
Okay.
How was that?
Great.
Arms out in front. How low can you go?
How low can you go?
Wow, that's definitely a lot faster and smoother. And you're at a 90. That's perfect. Slowly come back up. Look at you. And she even does it with a smile on her face this time. All right, let's do those stairs, Celeste.
Okay, let's do these stairs.
Oh my gosh, fast, and look at that.
No handrails.
No handrails. You're back to your old self again. How about that? All right, Celeste, let's talk about this. You were at an 8 when you started. What do you think your pain level is now?
Oh, I would say a 3 maybe.
Awesome.
Between a 3 and a 4.
And you,
But the flexibility is back.
good. And what about the balance? Do you feel like your balance
Right,
is
that's what I
better?
meant. The balance is better so that I'm not, grabbing.
Right. So you feel secure and
Right.
you feel like you can do it without any assistance.
Right. I'm not totally pain-free, but it's doable.
So let's talk about that Motrin and Aleve. When was the last time you took it?
6 a.m. So
All right.
So I'm 2 hours overdue for my dose.
Okay. And you feel okay?
I'm probably gonna let it go all afternoon.
All right. So one of the things we want you to do is we want you to go for a walk this afternoon.
Right.
Just like a 20-minute walk. We need you to keep that joint moving, keep it lubricated. And we can help strengthen those muscles, and then we'll have you come back in for your therapies. Vilma, why did you come in the office today?
I come in to do my first therapy because I want to be a pain-free.
And you have been having a knee problem, that right knee and left hip.
Yeah,
So how long have you been dealing with that discomfort and pain?
maybe for 3 or more years.
Wow, so a long time. What do you do for a living?
I working.
So are you standing a lot? Are you walking a lot?
In my job I stay sit more, but I love to do a lot of activities and I can't do it no more.
Okay, because the
I can't do
pain's
it no
just
more.
getting too
I
bad.
be at home. When I'm home, I be at home. I don't go anywhere because they
You-
bother me a lot.
It hurts. And
Even
you-
when I go to shopping, to my grocery or whatever, I have to buy right away because I can't.
Right. So what is your discomfort level right now in that knee?
10.
It's a 10, and it's always a 10. Go from a seated position to a standing position. Okay, where did you feel that? Right there, underneath that kneecap and on the inside. Any other place hurt you whenever you tried to stand?
When I stand,
And that hip right there too. Okay, all right. Keeping your heels on the ground, how low can you go down? And I know squatting's very difficult for you. I can see in your
so
face.
painful.
And slowly come back up. Where did you feel it?
Painful.
Did you feel it the same spots on the inside and on below that kneecap? Okay. I want you to hold on to that railing. And you live on a second story, so you have to go up and down stairs every day several times.
Thank God that I have bars.
Yes, that you have handrails. Yes. All right, and we're going to go back up the stairs. It is beautiful out here today. Okay, so Vilma, was it more painful going down the stairs or coming up the stairs?
Now it was so painful to go out.
To go up the stairs. And were you feeling it in those same hot spots that you were before? On the inside of that knee and below the kneecap. All right, so are you ready to get started?
Yes.
All right, welcome aboard.
Take a deep breath and pull up. 1 and 2 and 3. 3, 4, 5, 6.
Way up.
Pull. Pull.
That's
Pull.
it, Vilma.
Pull. Pull. Yes.
That was much farther.
Okay. Go. Pull. 1. Keep the other leg straight. Keep going. 3. You got it. You got to pull through it. Pull.
Breath, breathe.
You got it. Pull up. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 2. Keep going. All the way. Hold. And relax. 1, 2, 3, 4, 5, 6, 7. Arriba. Okay, bajo, down. 1, 2, 3, 4, 5, 6, 7. Arriba. Good.
Very good. Those knees are bending much better.
Yeah, you're walking better.
Oh, yeah.
You got some more.
How
work
you
to
feeling,
do.
Vilma?
It's different.
Much better. I think they went from 10 to 4 or 3.
That's good.
That's good.
That's a really good sign.
Vilma has finished her treatment with Dr. Davis, her non-surgical operation on that right knee. So, Vilma, can you stand up for me? How was that? Any pain or anything like that?
No, I don't feel pain.
Arms out in front. How low can you go? Vilma, that's much better. That is much better because you couldn't even squat it. Oh, look at you showing off. Go, Vilma. All right, girl, let's try those stairs.
I'm so happy.
I am so happy for you. And back up the stairs.
I don't even use it.
No handrails that time. Okay, now I'm going to really challenge you. I want you to use the handrail this time, but I only want you to place 1 foot per step.
Okay.
Okay? So I want you to try that for me, okay?
So 1,
Yep.
1, 2,
Yes.
3.
Yes.
Okay. Like this.
Yep. And now, yes. That's it. That's it. That's how you're supposed to walk up and down stairs. You couldn't do that before. Look at you. Vilma, what would you tell other people who haven't quite decided if they want to come in or not? What would you tell
Don't
them?
even think about it. Come. That is the best solution.
Perfect. Thank you and welcome to the family. We're going to put you on some therapies today and get you started on your nutrition.
Okay.
And we're going to have you dancing in no time.
I've had skeptics in the past. It's no different for you than it is for anyone that has ever come to our clinic that's a skeptic. The proof is in the pudding. Feeling better is what's going to help you understand the difference of having real, long-term corrective relief instead of just taking a pill to cover up the symptoms as your condition gets worse underneath the surface. I invite you to take the opportunity to connect with myself and my team. Allow us to explain exactly how it all works and what kind of benefits you're going to get from it. This process is all about helping you understand what it is so you don't have some made-up idea in your mind what it could be. Still have questions? Call the number on the screen and my team and I will be happy to discuss any concerns you might have. I look forward to meeting you and I look forward to helping you. God bless.